The Ghana Medical Association is raising concerns about government's failure to sign the document of their conditions of service. At the closing of the association's 61st annual conference in Tamale, it issued a communique, and the president of the GMA, Dr. Frank Ankobia, well, he joins me on the telephone. Good morning, Doc.
Good morning, Aniwa. How are you?
Very well, thank you. Yourself?
I'm blessed.
Awesome. Walk me through the key points raised in your communique after the conference.
Thank you very much, Aniwa. At the end of the conference, as it's the first annual general conference, first on the list was the conditions or the health of the prisoners. The theme was the health of the prisoners and other vulnerable groups, expectations and realities. And we realized that our prisoners, the health of our prisoners are not being taken care of as it's supposed to be. We of GMA believe that prisoners should have a similar care to those outside the prison walls. The care must be the same. There should be no discrimination. We went through the prisons and we realized that there were so many health issues. And a lot of these things were brought on as a result of overcrowding. Yeah. A prison that should hold 60 inmates now is holding over 300 inmates. So people tend to sleep in tents. That alone will affect the health of the prisoner. You don't have adequate rest, so it will affect your health. Talk about mental illness, depression, and all that. Then you go to skin diseases such as scabies, infectious diseases like tuberculosis and all others. You realize that we are really, really not taking care of the health of our prisoners. And we felt that this has reached a crisis point, and all stakeholders must come together so that we deliberate on how we're going to help our unfortunate brothers and sisters who happen to be in the prison. So one of our points was that we must actually take a critical look at our prisons. That was one of the conclusions. And then the other thing was our conditions of service, which we came out and then we gave a roadmap. And if I must say something little about the conditions of service, yes, we said that by 17th of January, which is a Sunday, if we do not have a signed conditions of service document, from the 18th, we are going to withdraw some of our services, the outpatient department services, OPD services. That will carry it out for 2 weeks. And then after 2 weeks, if it's not signed, we'll then withdraw our emergency services.
Okay, Doc, I will come back to your conditions of service because I have a few questions about that. But staying with the issue of prisoners, what exactly are you asking for? Are you asking that some of the prisoners be moved? Are you asking that some more money is released so that you're able to provide services? What exactly are you asking for, apart from creating some sort of awareness of what is going on in the prisons?
One, apart from the advocacy, I think we must have a stakeholders meeting and address the problem. This time it shouldn't be a talk shop. We must address the problem. GMA, we are going to write a position paper on that. But we have some ideas already. One, we believe that the 1 cedi 80 pesos that is used as a feeding fee for inmates, for abled adults, is grossly inadequate. It is grossly inadequate. How much are our students in a secondary school, how much is their feeding fee? In fact, 1 cedi 80 pesos for an adult is an insult. I'm sorry to say that, but it will not wash. So that you want to tell us it must be 60 pesos per meal. How much is pure water sold in Ghana? And you give an adult 1 cedi 80 pesos to have 3 square meals. I mean, I think as a nation, we have failed to address this situation. We must all bow our heads in shame because we all know 1 cedi 80 pesos is what you can do in Ghana, and yet we look on as this is what is given to prisoners, able bodies who are in jail. I mean, it's just unfortunate, and we should appeal to government. We should all appeal to government to actually increase it with immediate effect. That increment must come with immediate effect. Again, government must take a look at the prisons, look at their infrastructure. If any expansions could happen, that is fine.
Are you
Prisoners sorry?
No, go ahead.
Prisoners suffer a lot of stigmatization. Because of that, even when they go to the public hospitals, it's a different issue altogether. Government should think about a long-term solution of providing prisoners or the prisons with their own hospital, as we have with police hospital, military hospital. The prisons must have their hospital. And I think we should take a critical look at it. That is a very long-term measure. 2, 3, we should also look at what sends the people in there. Can we phantom or look at other forms of punishment apart from incarceration? Can we look at it? In that sense, the judiciary should help us. Let's look at it. If we need to review some of our laws to address certain situations, because if somebody should petty theft and things like that, why should it end them in jail? Because the law says so. So that the judge is handicapped. He has nothing to do than to send them in. But if we look at it and review some of our laws, then we can bring in non-custodian sentences. I wonder if the information that these people get in jail while they are in jail, whether it really works. We should channel things out so that they could have, these reformatory issues outside the prison.
Right.
And in the long term, we should also try as much as possible to prevent some of these things that send them to jail. So if we create employment for a lot of our youth and all those things, I'm sure they will not be going around snatching mobile phones, which will end them in jail and all that.
Yeah.
So these are things that we must look at. And I believe that if we have a stakeholders meeting, a lot more suggestions will come. And we'll put all this together because the health of our prisoners now is nothing to write home about.
Yes.
And it is all of us, it is our duty. It is our duty to make sure, I keep on saying, that prison is not for one person. You don't know what might end you there. Today you may be sane, your mind is working perfectly. The little blip and you're in jail.
Indeed.
So we must prepare, at least, even if we are not going there or somebody, but those who are there already must, have a good healthcare system.
Right. I completely agree with you. But let's move on to the other issue that we're talking about, and that's your conditions of service. Now, you have a meeting today over your concerns. What exactly are your expectations, and what would it take so that strike that's planned for the 18th will be cancelled?
Anyway.
Yes.
The issue is that, one, we have a meeting tomorrow. And my expectations are that we will resolve whatever issues are currently present, and then sign that document tomorrow, just as we finish with the meeting, so that our roadmap and all those other ones will become moot. Once we sign the conditions of service, the roadmap no longer exists.
Would you mind sharing with us some of the particulars of these conditions of service that you're looking for?
I'm sorry, no one discusses his or her conditions of service on radio. Government knows what we are talking about. We know what we are talking about.
Okay, fair enough.
The most important thing is for the two of us to come to a conclusion tomorrow and sign that document.
Okay. All right. Well, for the sake of all of Ghanaians, we wish you the best, and we hope that you're able to come to a satisfactory compromise. Thank you very much for joining us
Thank you
this morning.